njhs.org.
Every day, people tell me they're spending hundreds of dollars trying to cover up their cosmetic problems. But sometimes over-the-counter treatments don't cut it, and you got to fix the underlying tissues. That's why today I'm showing you two cutting-edge lasers that can treat multiple issues all at once, saving you time, money, and discomfort. And you know what? We're going to start with wrinkles, because you guys talk about them all the time. Here to help us with this project is dermatologist Dr. Makreen Alexihadis. How's that for pronunciation? With our patient, Patricia. Welcome, Patricia. So what are you looking to help out today?
I am looking to get rid of some fine lines and wrinkles around my mouth, especially under my eye, my neck, and my chest.
It's a lot of areas. All right. Help us with this. How are we going to make this happen? What makes this laser so cutting edge that could address all those areas?
Well, the Axle Pixel Q-switch laser is new and very different from any other laser in its category. It allows for a new cutting-edge technology to be employed such that the laser penetrates into the skin and stimulates the stem cells to produce collagen. But by bypassing the outermost layer of skin and not wounding it, it renders the treatment completely painless, with no downtime, and extraordinarily safe. And so it allows for it to be the treatment of choice, if you will, for rejuvenation for sensitive areas such as around the eyes, around the mouth, and the neck and the chest. And these are areas that historically were very difficult to treat because they were associated with an increased risk of burns and scars.
Interested in this?
Yeah?
Yeah, okay. So lie back if you don't mind. Show us how it works if you don't mind, Dr. McCrane.
Very good.
Are we supposed to put my goggles
first thing,
on?
right.
You guys don't need goggles yet. You'll need them in a second.
We put goggles on the patient, a certain type of goggles on the patient where she can't see, but we can see with ours.
They're very attractive shades.
Okay. Then you put the laser in ready mode and you get started.
And you gonna let me know if this hurts you at all, Patricia?
I will let you know what I feel.
So you're starting around the eye. Oh, it's pretty fast. Does that hurt you at all?
Nothing. Very, very slight pinch, but that's it.
And how long does it typically take to do an entire treatment?
20 minutes per site. So to do face alone would be about 20 minutes, but face, neck, and chest about 40.
And how many treatments in general do you need?
We recommend 3 to 5 treatments spaced about a month apart.
And I have to ask about cost because, again, I know that there are easier and cheaper ways of looking better, but I'm looking for long-term solutions here.
One of the other great advantages of this device is that it's very inexpensive compared to other modalities. So the typical average cost of treatment is around $300, whereas other rejuvenation treatments using laser cost around $1,200.
Right. So it's a lot less expensive. Okay.
Large.
So typically results will take about 6 months to be seen. And so I'm going to take these off you if you don't mind. There we are. I'm going to show you a picture of someone from before and after. Okay, there's a 6-month gap. So look at the picture before of this patient and look at the after right to follow. I mean, that is a huge difference. I think. Thank you, Dr. Dean. Thank you so much. All right, now, if you've got sun-damaged skin, the next lasers can take years off your face. Dermatologist Dr. Matthew Alvaram is here with his patient, Susie. How are you, Susie?
I am well.
So you've learned a little bit about this treatment. What are you here to get treated for?
I'm here to treat my sun damage. My dark pigmentation, freckles, years of not using sunscreen.
And you probably spend a lot of time trying to cover it up and...
I do, yeah. I use makeup every day.
And this is a solution, Dr. Alvaram, I'm told, is one that has some longevity to it. So teach us about it, if you don't mind.
Absolutely. So the Massachusetts General Hospital Dermatology Laser and Cosmetic Center is one of the leading laser centers in the world. And we literally have dozens of lasers to choose from. What I love about the Cyton Broadband Light Micro Laser Peel is it's a combination treatment and a one-time treatment that really provides significant results.
All right, so if you've got these problems, pay attention. Everyone put their glasses on if you don't mind. And we got some for you. We got eye patches for you, special eye patches.
Yes, we're going to just put the eye patches over your eyes here. Just turn towards me. So the first thing I'm going to do is this is just ultrasound gel. And this is just kind of to protect our skin when I do the first part of the procedure. And what's nice about this is that it's not particularly painful. So why don't you turn towards me?
Is particularly painful mean it's not painful, or does it hurt only a little bit?
Well, ask Susie. It really isn't very painful. Here's the first treatment.
Oh, my goodness. It's bright.
And again, yeah, it's just a very powerful flash lamp. And as I'm doing this, we're targeting on a very microscopic level the brown spots redness, broken blood vessels, and really clearing away the sun damage that's happened over the decades that she was out in the sun.
Well, I can already see changes. Susan, did that hurt at all?
No, not at all.
That's remarkable.
Okay, great. Now we're going to move to the second part of the procedure, which is the micro laser peel. And we're going to switch our we're going to change our goggles. And I'm going to use the second hand piece here.
Does this one work for me, the white ones?
Yes, those are the right goggles.
Okay.
And
very different kinds of eyewear today.
And what we're going to do...
You can trust me.
And so we're going to turn a smoke evacuator on now because as we discussed earlier, so you're going to hear a loud noise and you're going to feel the laser. Here we go.
Oh, my goodness.
And what just happened there is we vaporized the width of one sheet of paper from the top part of her skin, and it went into the smoke evacuator. Here's the next one, Susie. And again, that top layer of skin is going right into the evacuator. Are you comfortable?
Oh, I am. Yeah, it doesn't hurt. It feels like little pinpricks.
I'm just amazed it doesn't hurt you. We are taking off the top level of skin.
Yeah, so we've all heard of chemical peels. This is the same principle of removing the top layer of the skin, but we're doing on a very microscopic level with incredible precision with this laser.
So let's talk about cost here. So you can take these off your eyes so you can see again.
Oh, thanks.
There.
Thank you.
What's a rough cost for this? How often do you have to do it?
It costs about anywhere between $1,000 and $1,500 to do the treatment. And again, it's a one-time treatment. And again, the benefits would last for years.
So, just to be clear on this. So once you've done it that one time, you never have to come back and see Dr. Avram. You're done for other...
You're done for a few years. If you go back out in the sun and you're in the sun a lot, you're going to need to come back a little bit sooner. But this isn't something that you do monthly or every 6 months. There's a longevity to it.
Okay, so we have a picture that Dr. Avram shared this with us of a patient who's had a treatment before laser treatment, and then you see the after right next to it, 2 weeks after treatment. 2 weeks after treatment. You can come up there.
Oh, great.
So listen, I like this idea, the concept of getting rid of something that's structural once and for all. It took some sci-fi magic, but it allows us to go beneath the skin, not cause a lot of pain, either my guess, but give you some long-term results. That's very appealing. I hope you're happy.
I am.
I want to thank my guests and my physician friends as well. Now, if you want similar results for a fraction of the cost, up next, I've got the world's cheapest anti-aging product. Stay with us.
Up next.
I thought if it's that expensive, it must be good.
Think again. You can look younger for less. And later, and in case you missed it, bonus tip. The anti-aging product Dr. Oz can't live without. And Wednesday, breaking news. Fungicide found in orange juice. How it happened and why the FDA is concerned. Dr. Oz investigates. Is the orange juice in your refrigerator safe? That's coming up on Wednesday.
Have you joined yet? It's not too late to become a part of Dr. Oz's Transformation Nation $1 Million You. You guys ready to get fit? You'll look like $1 million, feel like $1 million, maybe even win $1 million. First, sign up at DrOz.com in partnership with Weight Watchers and powered by our partners at ShareCare.
I'm excited.
Then go to Weight Watchers anytime now through Sunday, February 26th for your complimentary weigh-in, and you're on your way.
When you realize that depression has left you nowhere to go, when you've lost interest in everything, when you've had one too many days feeling sad or anxious, aches and pains, fatigue, when it becomes hard to ignore that you need help, that's the day you do something. Depression hurts. Cymbalta can help with many symptoms of depression. Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thyroidazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAIDs, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing skin or eyes. Tell your doctor about all your medicines, including those for migraine. And while on Cymbalta, call right away if you have high fever, confusion and stiff muscles, or serious allergic skin reactions like blisters, peeling rash, hives, or mouth sores to address possible life-threatening conditions. Talk about your alcohol use, liver disease, and before you reduce or stop Cymbalta, dizziness or fainting may occur upon standing. Is today your day? Talk to your doctor and go to Cymbalta.com for a free trial offer. Depression hurts. Cymbalta can help.
Occasionally, I have
Diarrhea.
constipation.
Tummy troubles.
Culturelle Probiotic is clinically shown to improve your digestive health and strengthen your immune system. It's the good bacteria that makes you feel
Awesome.
One woman, one powerful savings tool, one chance to hunt